Welcome back to another Front Office Rocks video on YouTube, and thank you again for subscribing and joining us with these fun conversations. What I want to talk about now is a conversation that I just had with a client of ours who they had an upset patient about a balance that wasn't expected, which happens to all of us. Unfortunately, we do our best to estimate insurance, to estimate what they're going to pay. And no matter whether we predetermine it or not, or pre-authorize it, or call and get all the information, sometimes it just doesn't work out, and the patient ends up with a balance. So I have a lot of training on this on Front Office Rocks, how to talk to patients about their balance, how to make sure that we do our best to not end up with a surprise balance at the end. But one of the things that I wanted to talk about or just bring up here on YouTube with you guys is understanding that we're talking about a sensitive subject when we're talking to patients about money. We're talking about having them pay money for something they don't really want to have, which is dentistry, right? So we're talking about two subjects here, dentistry and money, not two of their favorite subjects, right? And it's understandable that the patients potentially would get upset. The issue is we work in this all day long. We work with insurances all day long. We see them downgrade. We see them change what they're going to pay. And so we start to get a little numb to it, we get a little dentally focused. I don't know what the word is. And we tend to forget sometimes that the person on the other end of the phone is just that. They're a person. And we have to put ourselves in their shoes for a minute. We have to recognize when we're talking to the patient that they're not happy. And that's okay. They're not mad at you necessarily. I mean, unless you guys messed up, they're not mad at you. They're just mad. They're upset. You know, they were going to spend that money on something else. They didn't expect the insurance not to pay it. And it's okay to acknowledge how they feel. It's okay to say, you know, I'm sorry, this really sucks, right? I mean, I would be upset too if I found out that I owed an extra $300 or whatever the case may be. Put yourself in the patient's shoes. I think so many times we're so focused on getting to pay, getting the insurance, getting this done, get them in the schedule, get them on the next treatment. We don't slow down enough to really just recognize the patient and give them a minute. And what that means for one patient might be different from another patient. You know, one patient may rant for 5 minutes or 3 minutes. Okay, great, let them rant, right? One patient might be upset. One patient may need to go and have to call you back and they need some time to think about it, or whatever the case may be. Work with the patient to help them because everybody processes this differently. And when you can actually show the patient that you care, when you can show the patient that I'm sorry, this really sucks, right? Maybe you don't want to say sucks. That's kind of my personality, but I'm really sorry. This is a surprise. I could see why you're upset. I mean, your insurance told us one thing and then they did something else. And acknowledge them, acknowledge what you hear from them, let them know that you understand. That doesn't mean that you're going to write it off. That doesn't mean that they can't pay it, but just that they understand that you care. That's the first step to helping them get to the next step, which is, okay, now what do we do about it? Okay. And that's where you want to get the patient to go. So these conversations are hard. Sometimes you have no idea who's going to get upset about the balance. Some people are like, oh, wow, that sucks. Okay, I'll put it on my HSA. And other people who you don't expect get upset by a $25 balance. So you kind of have to be ready. They're hard to do, I know sometimes, but you have to be there for the patient, be confident, be caring, really communicate with them. And at the end of the day, patients are going to thank you for that. Maybe not initially, but over time, they're going to appreciate the fact that you cared about them enough to talk them through this whenever they had an unexpected balance. So there's just one tip for me just to say, really, really remember that these patients are people too. I know that sounds silly, but sometimes we forget that in the office. And then if you need more help with this, like I said, we have tons of training on this in Front Office Rocks because customer service isn't just about making everybody happy. It's also how you deal with the problems. And there are going to be issues that come up. And the way you deal with them is really how customer service is viewed by our patients. So do your best to try to get through the good conversations and the bad conversations and having the patients love you on the back end. Please make sure you subscribe to this channel if you want more videos like this. There's a ton already here for you. And I would love it if you share this with other people. I plan on continuing to do videos and talk about the topics we care about in the dental industry and offices. So please share this with people who you think might be interested. And at this point, I hope you have no hard conversations today, but if you do, I hope this little bit helps. Thanks, guys. Have a great day.